Orete, you ready? We're live!
You already started?
The patient is giggling at me. I don't know if she's giggling with me or at me. We're live again. Double whammy today. I represent to you guys a case that I posted, I believe, on Saturday about a minimally invasive procedures that we performed on this patient. This is a very young patient who presented with a chief complaint of my toes are floating. So both of her fifth little toes were actually floating. So looking at the foot from the front, the toe was kind of like this, and it was overwriting. If you guys look at our Facebook fan page, you guys will see the clinical pictures, the before and after, but there's nothing like video. So I really want for everyone out there to see what we did. Hugo, please come around here. Make sure we have a nice clear view. So again, as everyone can see, and I'll just make believe this was the toe, before, the toe was actually lifted, right, like that, sort of overwriting the fourth, both. And what we did was we performed a percutaneous, minimally invasive procedure to lower. Dr. Fernandez is helping us out here today, as it lowered both toes. So now the toes can actually purchase the ground. So I'm super happy with I'm gonna say the functional as well as the aesthetic result. Okay, I don't usually dedicate these videos to people, but I like to dedicate this video to TJ, who knows who he is, and of course Dr. Fernandez as well. But here at Jaws Podiatry, we continue to use minimally invasive. It's what we called MIFAS, right? Which is an acronym which stands for Minimally Invasive Foot and Ankle Surgery Techniques. And we're continuing. Thank you, Dr. Fernandez.
Very well.
Next time I know exactly who not to call. We continue to implement these. It's more of a philosophy / techniques that we're implementing and that we continue to implement here at Jaws Podiatry. So we can perform these procedures through these tiny little ports, tiny little holes. Anywhere between 1 millimeter and 2, maybe tops 3, and there's a lot of pros in pursuing these types of techniques. There's a time and a place, of course, open traditional versus the minimally invasive, but I will continue to educate the community on what of these procedures that we continue to perform here at Jaws Podiatry. A lot of patients, as well as people from South Florida, continue to write to us, and more recently they've reached out to us asking about these types of procedures that we can actually perform actually here in our. You still there? Yeah. In the office-based setting as well. I'd like to thank all the viewers, like always. If you guys have any questions, please feel free to reach out to us in any of our social media platforms. www.jawspodiatry.com. Number 2, Facebook, Jaws Podiatry. Number 3, Instagram, Dr. Toe Jam. And number 4, our YouTube channel, Jaws Healthcare. We're going to definitely upload this video there as well. That's if you don't give anyone out there Dr. Fernandez vertigo after this video. This is not a GoPro camera, but on a serious note, if anyone has any questions on minimally invasive foot and ankle surgery, please, I urge everyone to reach out, ask questions. We do have our telehealth platform where we can actually talk to patients from all around the world, and we continue to do so specifically when it comes to any of the aesthetic procedures, as well as the minimally invasive foot and ankle minimally invasive procedures. Like always, thank you for watching, and I hope everyone has a wonderful rest of the day. Ciao.